Hey guys, it's Bill. Quick video review of what we talked about this week in imaging. Sorry, I was a little late on the responses this week. I was teaching a weekend course as part of our residency. Once again, great job on the discussion board. I think everybody brought in some valid points from the research, from the PowerPoints and readings, and also from your own clinical practice. It's a current hot topic is concussion or mild traumatic brain injury, however you want to call it or define it. And the imaging for head injuries, everybody kind of talked about that. Usually you start off with a CT scan that could indicate some sort of fracture or potential swelling in the brain where you have a midline shift or at least some fluid on the brain. Pretty clear-cut and accurate guidelines to suggest which patients would need imaging that have had head trauma. The vast majority that have concussion, just by definition, would not require imaging. And imaging really doesn't do anything in terms of management, prognosis for people with mild TBI or concussion. So I think everybody picked up on that. And also someone posted an article that it was like a retrospective analysis of pediatric head injuries and found that you could save about $750,000 by following the guidelines for who should get CT scans coming into the emergency department with head imaging, with head injuries, getting a CT scan. So you guys were very astute in picking that up and kind of understanding that in our country, you have a head injury, particularly in a kid, parent takes their child to urgent care or maybe an emergency department, they're probably going to get a CT scan whether they need it or not, even though we have pretty clear-cut guidelines. Probably a lot of that is driven by parental concerns and fear, things that you hear about in the news where someone sustains a head injury, they go to sleep and don't wake up, due to some sort of bleed in the brain. But the clinical signs for that are pretty clear cut in terms of us being able to be prognostic to determine who would actually have a serious event or who's at risk for a serious event after a head injury. And then it's probably also driven by physician fears for missing something, potentially being involved in a lawsuit. And then also, I think just physician culture and training is to kind of be thorough, kind of leave no stone unturned, even if it's just in case. So something that we'll probably continue to hear more about as our healthcare system evolves. Obviously, we have one of the most expensive in the world, yet our outcomes are not better than less expensive systems that perhaps don't use as much imaging, don't do as much surgery, don't use as many specialty referral providers. And I think a lot of you guys talked about this topic in terms of direct access, or even seeing patients on referral. We tend to get a lot of older adults that fall, maybe bump their head, and it's nice to have some guidelines there as well. And those are actually the more common types of concussion. They're not in the news as much as the sports-related concussions, but falls in older adults, leading concussion are probably the most common cause of a concussion. And they can actually be a little more tricky to manage because an older adult brain might take a little while longer to recover compared to a younger and healthier person. So you guys were pretty astute in picking that up. So great job once again. This week we're not going to have a discussion board because I'm going to give you time to do your article analysis. If you're not sure if the article is appropriate, just go ahead and email it to me and I can let you know. The biggest thing is it should be a diagnostic study involving an imaging technique, meaning the primary purpose of the research studies should be to determine how accurate a diagnostic imaging technique is for a given pathology or condition. So if they're using imaging maybe to determine how good a certain therapy is or medication, that's not the appropriate article for this analysis. It should be specifically a question about diagnosis. So if you have any questions, just shoot me an email, and I look forward to seeing what you guys find out in the literature and do your analysis.